Once the jewel in England's NHS crown, Salford Royal, a regular haunt for politicians wanting to show how to make a hospital work, including from this young health minister. Those politicians are noticeable now by their absence. The Greater Manchester Hospital and the wider trust, the Northern Care Alliance, is in crisis.
People are being discharged early so that we can clear beds, so that we can get people out of A&E, and then they come back into A&E.
In a joint investigation with The Independent, we've spoken with a dozen former and current staff and can now reveal accusations of patients being harmed, of incidents being downgraded, and of chronic staff shortages.
I have evidence that investigations were manipulated, closed down, and resulted generally in no meaningful outcome.
Even when patients have been harmed, the reviews are not thorough.
The Northern Care Alliance was created in 2017 and it's now made up of 4 hospitals: Salford, Oldham, Rochdale and Bury, serving over 1 million people across Greater Manchester, making it one of the largest in England. Some staff saying that in itself is one of its problems. This is a trust that has gone from highly rated to having an enforcement notice issued by NHS England, and that's about as bad as it can get, because that's saying they've either breached their safety standards or their statutory legal requirements. And the Care Quality Commission has also intervened and issued a warning notice about its surgical services, and we're waiting for that report. It's due shortly. Concerns into the spinal unit were previously investigated after disgraced surgeon John Bradley Williamson botched numerous operations. But we've been told issues span the Trust's departments in renal, neuro, maternity, gynecology, and this from a clinician in emergency care.
Overcrowding and poor care, people on corridors dying, deteriorating, or just elderly people lying on a corridor on a hard trolley because you can't put beds there. I mean, the longest we've ever had somebody wait for a bed is 4 days on a corridor. It's unsafe and it's inhumane.
She told us she was aware complaints had been made to management by a group of clinical staff, but, she says, they had been asked to shut it down. We're told they refused.
We've had cardiac arrests in corridors. We've had cardiac arrests in our resus department, which has 12 beds, and we were having 17 in there.
And we've now seen a leaked survey of 400 consultants from across the Trust and from different departments, taken last November. Nearly 81% said patient safety was worse than in pre-COVID times, and 75% did not believe the Trust was well led. In April, the chief executive announced he was leaving. Yet still, the staff complaints persist. A system called Datex is used to record incidents, some of them minor, some of them much more serious. Yet repeatedly during this investigation, we have been told of the Trust management downgrading incidents, or asking that they be closed down, or closing them down themselves without taking any action. Vanessa Lawton was a consultant gynecologist at Salford until she resigned in April.
Many are not investigated at all. They're just closed down and left blank, or irrelevant comments are made and it's closed down, even when patients have been harmed.
Before Dr. Lawton left, she sent a letter to the Care Quality Commission saying that she was retiring earlier than planned because, she writes, I feel unable to continue working in a department that is unstable and chaotic, with poor cultures, lacking safety for patients and psychological safety for staff. I am the 3rd consultant to leave in a matter of months. I could not countenance being referred as a patient to my own department. One of the issues she's highlighted was the introduction of shorter appointment times to clear backlogs, but that meant, she said, cancers were missed.
A patient came with postmenopausal bleeding to one of these weekend clinics with the short appointments. The pathway that we'd normally use to document that process was not completed. And she was not clinically examined, which is always part of the process. The GP referred her back immediately. And I think the second consultant made assumptions about what had happened, and he didn't examine her either. And then she came in and with advanced cancer in about 4 to 5 months later and died. She was in her early 50s. So that was probably a preventable death. The investigation does not cover the important features of that, nor consider the short appointment effect.
The problems at the NCA have been escalated, even as far as the Greater Manchester Integrated Partnership, until recently co-chaired by Andy Burnham. One email sent to his office said,
"Trust-wide systems which permitted so many patients to be harmed for decades within the current NCA are probably unlikely to be due to an individual rotten apple or confined to just one department."
The former Mayor's office told us that as a result the Trust lost its membership of the Greater Manchester Good Employment Charter. And tonight the Department of Health told us that patients at Salford had been severely let down. Glyn Smurthwaite was a consultant at Salford until his retirement in 2023. He says the investigations into patient harm incidents were treated as a tick-box exercise.
I'm in very close contact with many consultant colleagues on a daily or weekly basis. I know areas across the patch, across several of the NCA sites, where ongoing harm is happening in the here and now. A clinical case that I have some detailed knowledge about generated adverse incidents after I'd left, and they were investigated again in the same malevolent way of trying to defocus from the prime problem. Whether this is malevolent or deliberate or just incompetent, I actually don't know.
Well, you've used that word malevolent quite a few times, so you obviously think...
I think it is malevolent because I think it comes back to the mantra of anything we do needs to protect the reputation of the organisation.
The Northern Care Alliance admitted it was facing challenges and was working to address concerns colleagues have raised and to address staff sickness absence. They added, "We have clear processes to investigate incidents, and learning from these is an area we need to prioritise. By doing this, we can drive forward improvements and maintain our focus on safety." A statement that effectively says we hold our hands up, but without saying how this once illustrious trust found itself in such trouble.
Victoria McDonald reporting. And the Department of Health told us that NHS England is working at pace with the Northern Care Alliance to support rapid improvement and accountability.